Welcome back. Well, from politics to the cost of living. You know, the increase in the cost of living has had a big impact on you. You can see the strike by the union Nahawu, where members say they cannot survive on the increase that government is offering them. The same thing is happening in many other places around the world. In the UK, nurses have been on strike there too, also over the cost of living. Now, the International SOS Risk Outlook report says the cost of living crisis around the world may have an impact on the productivity of companies. Dr. Chris van Straten is a global health advisor for clinical governance at International SOS. Dr. van Straten, good afternoon to you. We all know how difficult it is to get by around the world at the moment. You've done your own assessment. What have you found?
Right, well, thanks so much for getting me on the call. And International SOS, in partnership with Ipsos Mori, it's a group in France, has been interviewing health and security risk managers from big companies around the world. And there's really 5 main points that they came up with. And the cost of living certainly is a part of it. And what we'd like to touch on there, and you'll see companies increasingly looking at, is how do we support the workforce? How do we get workforce well-being, especially in terms of mental health? And then how do we address these other issues to help start being productive, safe, and healthy, because it's affecting the bottom line.
I mean, one of the things is just the simple price of food. In South Africa, in the UK, in many places, the price of food has simply gone up dramatically, and that's what's making it tough for so many people.
Absolutely. And we've got in South Africa these dynamic impacts. So the survey was done globally, but also with a focus on some of the issues in and around South Africa. As we've seen with the protests, they're protesting because there are issues and concerns about cost of living, but the protests too will impact on the people, especially those seeking health or health care. The other issues that's related, I think, to the pandemic, cost of living, and then also the issues of the rolling blackouts. We're seeing escalating crime rates and people then having to fork out more, not just for the daily food on the table, but also how do you keep secure, how do you keep safe, or if you've been robbed, what can you do about it? And then that's been exacerbated by this concept of all the natural hazards, whether it's linked to climate change. And a term that was coined during this research and in a conference we had on Friday in the country with clients and colleagues, this concept of perma-crisis. It really feels, I think, for many, like there's just this one crisis after another. And how do you take care of that? How does a company look at those risks, identify where their core focus needs to be, and try to support their staff, whether it's a risk point of view, whether it's a security point of view, whether it's from a food point of view, and or whether it's the mental health, which I really think is something we're going to be hearing more about and seeing companies focus on.
So what's causing all of this? I realize that that's a very big question, right? Some of it is global warming, some of it is politics, some of it is maybe Russia's invasion of Ukraine. Also, I would imagine, you tell me if I'm right, the tensions between the US and China. All of these things, and then of course coming out of the pandemic, all of these things are building on each other.
Absolutely. By the way, I don't often quote from my favorite authors on television interviews, but I was thinking about this recently and how to frame it, and I'm a Tolkien fan, and there's a scene in the film, but also in the book, where Frodo says, I wish it need not happen in my time, and then Gandalf says, so do I, and so do all who live to see such times, but that is not for them to decide. All we have to decide is what to do with the time that is given us. So you've touched on it. It has to do with this really unfortunate timing in terms of a global pandemic, in terms of the geopolitics involved with the Russian invasion of Ukraine, the mounting tensions between China and the USA, and then the timing of the rolling blackouts in South Africa. I don't think you could have had worse timing on that. And what big companies are looking at, all companies really, but companies in South Africa and those wanting to navigate or operate successfully in South Africa in spite of the challenges, or on the African continent in spite of the challenges, to say, right, so where are the risks? How can we track and monitor that data? That's something that's come up time and time again, pre-pandemic, during the pandemic, and especially now. Where are you getting your data? How do we know it's trusted? How do we interpret that? And then this other aspect of that is how can we mitigate these risks and continue to find a solution? We have to find ways of navigating these challenges.
One of the things is, and I'm sure you've seen this, is that there just seems to be shock after shock. You know, Russia's invasion was a shock. The comments that came from the Chinese leadership against the US last week, well, were maybe expected in some circles, probably came as a shock to many. To wake up this morning to discover that over the weekend the United States federal government shut 2 banks, you know, that was a shock. That was unexpected. The shocks keep coming. Do we need to just prepare better for shocks? You talk about data. Are there only shocks because we just don't know enough about what's happening?
Well, that's a great question. It's also really complex, which we had an hour to. I think there are multiple layers to this. One is there's over 9 billion people on a planet, and a planet that's now more and more interconnected, not just digitally, financially, internet, etc. So I think a lot of it has to do with momentum, and some of it also relates to the tipping point. Another aspect, too, that is I think a lot about, but I don't think spoken enough about, is our impact on the natural environment. Climate, or let's say warming or heating is one aspect of it, but some of the infectious diseases we've had to battle just in the last 18 months, and not just COVID. That was Ebola, whether it's the DRC or parts of Kenya, plague in parts of Central Africa and in Madagascar. These are all, and mpox, all conditions that could have been prevented or mitigated had we been more aware of our impact on the natural world. So I think we're reaching partly a tipping point, whether it's geopolitically, whether it's from a climate and environment context, and whether it's going to, as you said, part of it is awareness too. We are more aware, there is more media and a media cycle, but I do think these things are real, and I think increasingly, that's why we used the term earlier, perma-crisis. And it's not sustainable to live in constant perma-crisis, so what companies are doing is going, okay, we need to constantly be revisiting our risk strategies, our data strategies, our mitigation strategies, and try and work this together in a way that's cohesive. Hope that helps.
Dr. Chris van Straten, thank you. Global Health Advisor for Clinical Governance at International SOS. So much more to talk about, not just anything involving hobbits and dwarves and elves and orcs. Thanks very much indeed. A lot more to come in the next little while on Newsfeed. Also the latest from Tshwane.